This video is on the marks weightage of NEET PG. Now, why the marks weightage of each subject for NEET PG is important. Before any match, you need to know the strength and the weaknesses of your opponent, right? So before giving NEET PG exam also, you should know that how much marks is allotted to which subject, and according to that only you would strategize your plan. And why I am focusing on the marks distribution of only NEET PG? Because in the new NEET PG pattern, the marks distribution has been more or less the constant. And what is the new NEET PG pattern? I would tell you in the end of the video. So hello everyone, I am Dr. Mayukh Hazra. I got AI at 29 in NEET PG 2023 and I am a second year dermatology resident. So according to the subjects, what is the marks weightage in the last 4 years average I have taken, and the last year, that is NEET PG 2024 morning shift, what is the marks I am showing? Anatomy, it was 7, it was 9 in this year. Physio 7, 7, same. Biochem 13, 13, the same. Patho 14, this time 14, same. Micro 12, 12, same. Pharma 14, this time it was 18, a bit more. FMT 9, average was this time 12, it was a bit more. Commed has been same. ENT more or less the same. Eye more or less the same. Dermat more or less the same. Radio more or less the same. Psyche also more or less the same. Anesthesia same. Ortho 6, 6 and 4. Medicine 21, this time also it was 21, the same. Surgery more or less the same. OBGY a bit reduced, and PD from 9 it has been reduced to 5. So if you compare both, you would find much of similarity. That shows that the marks distribution has not changed that much in the NEET PG. Now, if you are new to my channel, then do consider subscribing to my channel, because you would get n number of videos on NEET PG preparation. Now, if we see the marks distribution in a pie chart, because we can classify the subjects, this all into preclinical, this all into the shorts, and this 4 major clinical subjects into major subjects. In the pie chart, we can see the preclinical subject is of major chunk in the last 4 years average, that is the new NEET PG pattern. So preclinical 91 marks are allotted. So your pre and paraclinical subjects are of utmost importance. And the major 4 subjects also 72 marks. So major 4 subjects are also very much important. Less important is the short subjects. Now we have to know which are the high yield subjects. High yield subjects are not those which have the maximum number of questions. High yield subjects are those in which if you give the minimum amount of effort, you would get the maximum amount of result. Like medicine has the most number of questions, but it is not that much high yield. So if you cover pathology and pharmacology, much of the questions you would get common from the medicine section also. So the high yield subjects are biochemistry, pharmacology, pathology, like in biochemistry vitamins, in pharmacology the side effects, pathology lung cancer and blood transfusion, OBGY, surgery, pediatrics, dermat and ENT. These are all the high yield subjects. So in conclusion, if I have to draw one point, I have to say you that is the preclinical subjects. If you lack time, ideally you should do all the subjects, but if anyone is lacking short of time at the end, then preclinical subjects, the major 4 subjects and the high yield minors, that is the dermat and the ENT, that would take less number of hours to cover. It would cover your 175 questions, that is 14 subjects equals to 88% of the questions. This is the new NEET PG pattern. This is the marks weightage of new NEET PG pattern. New NEET PG is the NEET PG from 2021 to 2024. If you want to know the changing patterns of NEET PG and what is actually the new NEET PG and how it has changed from previous to now, then you can see a video here. Just go watch the video. It is very, very much important. So all the best for you NEET PG exam. See you in a next video.